Let's discuss some common myths and misconceptions regarding heart disease. The first one is that, I don't have to worry about heart disease if I'm young or under 40. Well, unfortunately, cardiovascular disease is an increasing problem in people that are under the age of 40 or 45. It's best to still go to your doctor's appointments and ask for screening for risk factors for cardiovascular disease so that it can be prevented or minimized even if you're young. Another myth is that smoking only affects the lungs. Unfortunately, that's not true. Smoking is actually one of the number one causes of aortic disease, which we talked about in another video, also peripheral artery disease, and heart disease. And it can also cause high blood pressure. So even though smoking affects the lungs, it really does affect every system in the body and can increase somebody's risk for really, really bad things to happen from a heart and vascular perspective. There's also a misconception that heart disease only affects men, because a lot of times in our advertisements we see a video of a man holding his chest and having chest pain. But unfortunately, bad news for women is that we are also affected by heart disease, and it is one of the top 5 causes of death of women in the United States. We need to be very, very careful about making sure that we're minimizing our risk factors too. There's another myth or misconception that chest pain might be the only sign of a heart attack or cardiovascular disease. In reality, all of our systems are connected. So while chest pain might be one of the signs, having difficulty walking upstairs or exertional dyspnea or having some pain at rest or any of those things can be a warning sign for cardiovascular disease. Also, having a history of diabetes or high blood pressure and other signs like having some pain in your foot that won't go away or having numbness and tingling in your fingers or toes can be a sign of cardiovascular disease. A lot of times I hear patients say, well, doc, I'm taking my diabetes medicine. Do I really need to worry about my risk for heart or vascular disease? And unfortunately, the answer is yes, because oftentimes people with diabetes have had years of untreated diabetes, and the damage can sometimes have been done for a long time and gone unnoticed. For heart disease as well as vascular disease, diabetes being a major cause, I still recommend patients that are taking their medications to get regular screenings and regular foot exams to assess for peripheral vascular disease.